Cholecystitis is a condition characterized by the swelling and inflammation of the gallbladder, which is a small organ that sits under your liver on the right side of your abdomen. Its main job is to store bile, which is a digestive fluid that helps break down fats in the food you eat. When cholecystitis occurs, the gallbladder walls become swollen and inflamed. This inflammation typically happens when something blocks the flow of bile out of your gallbladder. Think of it like a water balloon that's being filled but can't release its contents. The pressure builds up, the walls stretch, and the tissue becomes irritated and inflamed. This blockage is most often caused by gallstones, but other factors can cause it too. If the condition continues without treatment, the gallbladder tissue can start to deteriorate, leading to potential complications like tissue death, called gangrene, or even rupture. Cholecystitis is a relatively common condition, affecting about 10 to 15% of adults globally, primarily due to gallstone-related issues. It is more prevalent in women than men and becomes increasingly common with age, especially in individuals over 40. Types of cholecystitis. Cholecystitis is generally categorized into two main types based on its cause and presentation. Number 1. Acute cholecystitis. This type occurs suddenly, usually due to a gallstone blocking the cystic duct, which prevents bile from flowing out of the gallbladder. The blockage leads to a rapid buildup of bile, causing inflammation, pain, and infection in some cases. Acute cholecystitis is often accompanied by severe symptoms and requires prompt medical treatment. Number 2. Chronic cholecystitis. This form develops over time, often due to repeated episodes of gallbladder inflammation. Chronic cholecystitis leads to thickening and scarring of the gallbladder walls, reducing its ability to function properly. People with chronic cholecystitis may experience intermittent discomfort or pain after eating fatty foods, along with digestive issues. Causes of cholecystitis. The most common cause of cholecystitis is gallstones, but there are other potential triggers as well. Here are the key causes. Number 1. Gallstones. The majority of cholecystitis cases are linked to gallstones, which block the cystic duct and trap bile in the gallbladder. This trapped bile irritates the gallbladder lining, leading to inflammation. Number 2. Infections. Bacterial infections, such as those caused by Escherichia coli or Klebsiella, can lead to cholecystitis, especially in individuals with weakened immune systems. Number 3. Tumors. In rare cases, tumors in the liver, pancreas, or gallbladder can block bile flow, resulting in inflammation. Number 4. Trauma or injury. Abdominal injuries or surgeries can sometimes cause inflammation in the gallbladder. Number 5. Acalculous cholecystitis. This is a less common form of cholecystitis that occurs without the presence of gallstones. It is often seen in critically ill patients and may result from reduced blood flow to the gallbladder or bile stasis. Symptoms of cholecystitis. The experience of cholecystitis is quite distinctive. Most people first notice a severe pain in their upper right abdomen. This isn't a mild discomfort. It's often an intense pain that feels like something is seriously wrong. The pain typically starts suddenly and gets worse quickly. Many people describe the pain as radiating to their back or right shoulder blade. It often becomes more intense after eating, especially fatty foods. You might feel like there's constant pressure in your upper abdomen that won't go away no matter what you do. Along with the pain, you'll likely feel nauseated and might vomit. Your abdomen becomes tender to touch, and you might find yourself avoiding certain movements because they make the pain worse. A fever often develops, and you'll probably feel generally unwell, like you're coming down with something serious. Your appetite typically disappears. Even thinking about food might make you feel worse. The discomfort can last for hours, and unlike regular indigestion, it won't get better with antacids or by changing position. This persistent nature of the symptoms is often what drives people to seek medical help. In severe rare cases, if the bile flow is completely blocked, it can lead to jaundice, which is the yellowing of the skin and eyes, along with dark urine and pale stools. These signs indicate a more advanced stage of the condition and require immediate medical attention. Diagnosis of cholecystitis. When you go to the doctor with suspected cholecystitis, they'll start by asking about your symptoms and examining your abdomen. During the physical exam, they'll gently press on different areas to check for tenderness and pain. A common sign they look for is something called Murphy's sign, which is when pressing under the right rib cage causes you to catch your breath from pain. The next step usually involves an ultrasound of your abdomen. This painless test uses sound waves to create images of your gallbladder and can show both inflammation and any gallstones that might be present. Sometimes, doctors might also order a CT scan for a more detailed view of your gallbladder and surrounding tissues. Another helpful test is called a HIDA scan, where a special dye is injected into your bloodstream. This dye travels to your liver and gallbladder, letting doctors see how well your gallbladder is working. They'll also take blood samples to check for signs of infection and inflammation, and to make sure your liver is functioning properly. Before we continue, if you have been finding the video helpful so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Treatment for cholecystitis. The treatment for cholecystitis typically happens in stages. In the beginning, when you're first diagnosed and in pain, the focus is on making you comfortable and preventing complications. You'll need to stop eating and drinking temporarily to give your gallbladder a rest. Instead, you'll receive fluids through an IV to keep you hydrated. Your doctor will give you medication to control the pain, and if there's an infection, you will be given antibiotics. After these treatments, your symptoms may get better. However, if the condition is caused by gallstones, then the ultimate solution is surgery to remove the gallbladder, called a cholecystectomy. Now you might wonder how you can live without your gallbladder. Well, the good news is that you can live a completely normal life without it. Your liver will continue to produce bile, which will flow directly into your small intestine instead of being stored first. The most common surgical approach is laparoscopic cholecystectomy, where the surgeon makes several small incisions and uses special instruments with a camera to remove your gallbladder. This approach usually means less pain and a faster recovery compared to traditional open surgery. However, in some cases, particularly if there's severe inflammation or other complications, traditional open surgery might be necessary. In some cases, for individuals who are not candidates for surgery due to other health issues, a procedure called percutaneous cholecystostomy may be performed. This involves inserting a catheter to drain the infected bile from the gallbladder. Recovery and life after surgery. Recovery from gallbladder surgery is usually straightforward, but it's important to know what to expect. After laparoscopic surgery, most people can go home the same day or the next day. You'll likely feel sore for a few days, but this improves quickly. Most people can return to their normal activities within a week or two. Your diet after surgery needs special attention. Start with clear liquids and gradually add solid foods as you feel comfortable. Most people can eventually eat normally, but it's wise to make changes slowly. Pay attention to how different foods affect you. Some people find that very fatty or spicy foods cause discomfort at first. At the end, most people who have their gallbladder removed go on to live completely normal lives. Your body will adapt to functioning without a gallbladder, and most people don't need to follow any special diet long term. Now, we want to hear from you. Have you or someone you know experienced cholecystitis? What helps the most during recovery, and what advice would you give to others dealing with this condition? Share with us your experiences and opinions in the comments below. We'd love to hear them. Thanks for watching.